welcome to Lecture Topic Week 2. I'm going to try to keep this brief. Hope you like the open book quizzes. The most important thing you can do in the age of information is know how to access information readily. You can't be expected to memorize all the information you learn in this class, but it's very important that you learn where to look up the resource information when you need it, when you get out to practice massage therapy. Every person who comes to you for a massage should fill out a health history form, and you will, from the health history form, have an interview with a client in which you talk about what medical conditions they have and what medications they're on and so forth. And you couldn't possibly memorize all the information in the Massage Therapist Guide to Pathology and be able to just automatically know what to do. That's why you'll want to hang on to your resource information, both your textbook, the Massage Therapist Guide to Pathology, and also the Medical Language Instant Translator. They're excellent tools to have when you are doing a client intake interview at the first visit. If the client has something, you can look it up. I always recommend that you try to screen clients on the telephone before they ever get to your practice, so that in case they do have a medical condition that's contraindicated and you need medical clearance for it, that you would have time to do that before the client gets there. Also, it will give you time if they're on any medications to look up and see what those are and see how massage therapy might affect those. If you look in Appendix C of your your Massage Therapist Guide to Pathology, you'll find a section on medications and what to do in certain cases. One thing I want to tell you is that you know that you're learning now about a lot of medical things, but you are not, as a massage therapist, a medical professional. Never ever consider yourself to be a medical professional. You have some knowledge about medical things, but you are definitely not, it's not in your scope of practice to diagnose any condition or give medical advice. So please remember that. Sometimes I think when I first looked at the textbook, it gives students the impression that they're working as medical professionals, and they in fact are not. The scope of massage therapy practice is hands-on soft tissue manipulation, and it's rare that you find massage therapists in medical settings. However, that is becoming a little more common. And because it is becoming a little more common, and probably will be way more common as massage therapy becomes licensed in the state of Michigan, which it has, and by 2010 we should all be licensed here. As we become more medicalized, we need to all be able to speak the same language as medical professionals and have the same standards. And so that's why in this class you're going to learn a little bit of medical terminology so that you can speak the same language, and also uphold the same standards as a medical professional, in that you want to first do no harm. And how you start by doing no harm is when a client comes in with a medical condition, you look it up and see if this is something that you should be working with or not with massage therapy. While the Massage Therapist Guide to Pathology is an excellent reference and is considered the industry standard, I want you to understand that not all the conditions, it's not necessarily cause and effect. If something is contraindicated, I want you to not work on it. Or if it requires medical clearance, it says so in the book, you definitely want to get medical clearance. But the author of the book was not a medical professional herself. She was a massage therapist who interviewed medical professionals, and together, based on those two disciplines, they came up with some possibilities of what could happen if you did massage on certain conditions. So that's how the book came about. But I worked in practice for 7 years before the first Massage Therapist Guide to Pathology came out, and I just want you to know that I didn't kill anybody. And I probably worked on some contraindicated conditions, but in those days we didn't. This was not the industry standard, and we didn't know. I would like you to refer to the article under Lecture Topic Week 2, written by Keith Eric Grant, PhD. He interviewed the insurer of the International Massage Therapy Association, and he was asking them what sorts of claims they got from massage therapists whose clients may have brought suit. And here's what he said. In response to your request about massage insurance claims over the past 5 years, with 30,040 members to date, we average about 1 claim per month. Most claims are covered by general liability, as they are claims caused by poor housekeeping like tripping and falling. So these are your slip and fall injuries. The client falls on the ice while coming into your office. Those are more common than actual injuries by massage therapists to someone's body. Just want you to know that. I think a lot of times massage therapy students get scared to practice when they start reading the stuff in this book. Just follow what they say, follow the recommendations, but don't be terrified to practice, okay? In fact, there was one girl who I think left the massage therapy practice, she said, because what she read in the book, she would never ever be able to practice massage therapy with so much to know. Don't be scared to practice massage therapy. It's a relatively benign modality, but you do have to just be aware and know that there are potentials to injure clients and follow the recommendations as given in the Massage Therapist's Guide to Pathology, and you should be fine. You'll need to look up in your medical language instant translator, the small book, a couple of conditions under diagnostic tests and procedures, the definitions of diagnostic tests and procedures. These are two things that will show up on your quiz. These relate to dermatological conditions, that means skin conditions, and I'd like you to look up biopsy, B-I-O-P-S-Y, and skin tests. These are things that a client may come to you on their health history and say, I just had a biopsy of a mole on my arm, and you'll want to know what a biopsy is, so don't be surprised if that doesn't show up on the test. As well, I'd like you to look at Appendix C of your medical Massage Therapist's Guide to Pathology and look up the section on medications and massage. I'm not asking you to exhaustively read about each medication, but I would like you to know where that is so that you can reference that when you need it. What else did I have to tell you here? Nothing else. This is going to conclude lecture topic week 2. I'm hoping that you enjoy the video format and that this helps you to assimilate the information. I'll see you next week.